EMCDDA, or the European Union Drugs Agency, formerly known as the EMCDDA, puts out the European Drug Report. The report collates together the national data sets that cover the areas of drug supply, illicit drug use and related health problems. Key harm reduction interventions are also highlighted. During this presentation, we will look at some of the main findings and, where relevant, how they apply to the Irish situation. Once again, the tagline of the report is everywhere, everything, everyone. This central message from the 2024 European Drug Report's analysis is that the impact of the use of illicit drugs is now seen almost everywhere in our society. Almost everything with psychoactive properties has the potential to be used as a drug. This means that everyone, whether directly or indirectly, can be affected by illicit drug use and the problems associated with it. The report also highlights the fact that most drugs are readily available. Such drugs are, however, missold, in that the consumer may be sold an entirely different drug to what they thought they were purchasing, or the purchased drug is adulterated with other substances. Therefore, polydrug consumption is common, whether by choice or otherwise. In addition, the EUDA is noting a growing concern around the levels of drug-related violence across Europe and how this is often connected to younger people. All this means that the European drug scene is a complex one and therefore requires thoughtful and nuanced responses. If we now turn to the headline figures, we can compare the lifetime use across Europe to the Irish data set. Lifetime use refers to people aged 15 to 64 who have used the particular drug at least once in their lifetime. Looking at three major drugs, we can see that the use of cannabis is broadly in line with the European average, but when we turn to looking at MDMA, more commonly known as ecstasy, or the stimulant drug cocaine, then the Irish figures are significantly higher than those recorded elsewhere in most places across the European continent. We will now look at a number of individual drugs, beginning with cannabis. Statistics relating to drug treatment portray a picture where cannabis plays an increasing part. This may be related to the increased levels of THC, the psychoactive ingredient of cannabis. We also have the appearance of new forms of cannabis and developments in the way in which it can be consumed. Further research is, however, needed to confirm the situation. Recent years have also seen the appearance of a new range of cannabis-based products across Europe. Containing very low levels of THC, they present a challenge for regulatory, legal and health authorities alike. In addition to higher strength and new formats, we have also seen the emergence in recent years of cannabinoids that are either fully synthetic, as in they are man-made, or semi-synthetic, whereby a secondary process is applied to substances already extracted from the cannabis plant. It appears the most important semi-synthetic cannabinoid being sold at the moment is HHC. As it is derived from CBD, it is currently legal under Irish law. Its effects, however, appear to be similar to that of THC. It is most commonly sold in the form of a vape. When it came to MDMA, or ecstasy as it is more commonly known, the report clearly showed the continued production of higher strength pills and powders. At least half of the reporting countries noted the average amount of MDMA in a tablet to be between 140 and 157 milligrams. Such strength is high by historical standards and may lead to higher numbers of hospital presentations in the future. A particular note was made of the situation in Turkey. 1 in 5 drug-related deaths in the country in 2022, or 46 in total, appear to be MDMA related, much higher than levels recorded elsewhere. Turkey welcomes around 45 million tourists each year, many of whom are young and seeking out nightlife experiences. In 2022, for the 6th year in a row, EU member states reported a record amount of cocaine seized, totalling 323 tonnes. Belgium, Spain and the Netherlands remain the countries reporting the highest volume of seizures, reflecting their importance as entry points for cocaine trafficked into Europe. As the second most used illicit drug in Europe, concerns around the effects of cocaine are increasing, not least because of the strain it may put on emergency services and hospitals. Treating people with problems associated with their cocaine use is challenging, whether they are clients that are more socially integrated and involved in casual or episodic use of cocaine powder, or more marginalised groups injecting the drug or smoking crack cocaine. Heroin remains Europe's most commonly used illicit opioid and is responsible for a large share of the health burden attributed to illicit drug consumption. Europe's opioid problem, however, continues to evolve in ways that are likely to have important implications on how we address issues in this area. The primary fact is here that heroin users as a group are getting older and may experience other age-related medical conditions. Currently, synthetic opioids play a relatively small role in the drug market in Europe overall, but they are a significant problem in some countries, and there are signals that they could have the potential to play a larger role in Europe's problems in the future. The United Nations Office on Drugs and Crime has estimated a 95% drop in opium cultivation in 2023 in Afghanistan, following the Taliban's opium ban. While it is too early to determine the full impact of this development on European drug markets, if sustained, it is likely to affect the availability of heroin in Europe in the coming years. As with cannabis, we have seen an emergence of new synthetic and semi-synthetic opioids. Fentanyl has become part of the opioid scene in recent years, but now a new range of opioids known as nitazenes have begun to appear. More details on nitazenes and the Irish response to them can be found on a separate presentation on this website. Every year, new psychoactive substances are detected throughout Europe. Despite new legislation, the amount of such drugs seized has again risen. We have already mentioned nitazenes, which come into this category, but the main subcategory here is synthetic cathinones. They can be sold by themselves, but more commonly turn up in more well-known drugs such as ecstasy. If we combine synthetic cathinones with amphetamine, methamphetamine, and the various derivatives, then we can identify another dynamic part of the overall drug market. The European Drug Report argues that there needs to be more of a focus on this area, not least because of the use of such stimulants on the chemsex scene and the number of increased presentations noted in emergency departments. A range of other drugs have also recently raised a variety of concerns in certain countries or cities around Europe. Ketamine has become well established over the past few years, but combined with other drugs, including a range of stimulants and hallucinogenics, the resulting product is marketed as 2C or 2CB. Being a mixture of drugs, the effects and risks involved are not consistent. The pink food colouring is common, as is an attempt to misleadingly market it as a form of upmarket cocaine. The misuse of solvents, and in particular breathing in from a balloon filled with nitrous oxide or laughing gas, has become common in party hotspots around Europe. LSD, GHB, commonly referred to as G on the chemsex scene, and magic mushrooms have all been subject to some concern over the past year. Details of the effects and risks can be found at useful websites such as drugs.ie. The report welcomed the increasing range of harm reduction services that have been made available across Europe, especially in an attempt to reduce the number of opiate-related fatalities. It did, however, also highlight the need to be prepared for more potent new drugs that may be coming down the line. The report suggested that there should be a focus on rapid communication around drug harms to both professional and people who use drugs. The Irish experience around nitazenes was praised as an example of good practice. The report also highlighted a number of emerging challenges for harm reduction focused services. Possible increases in the rate of HIV infection in particular cities possibly linked to the evolving chemsex scene, was noted. Also, people who use cannabis may be encountering a greater range of products that use higher strength forms of THC, the active ingredient of cannabis. This may result in a number of health issues for them. Finally, it was noted that existing and planned harm reduction measures remain somewhat controversial, and therefore implementation of such measures is still challenging. Thank you for listening to our presentation today. If you have any feedback for us, then do please contact us at training@wrdatf.ae. A range of e-learning modules are also available for you to have a look at. You can find them on the training page of the Drug Task Force website. Thank you.